Hi, my name is Ashley Sachs, and I have developed a plan to implement in a local primary care clinic addressing the problem of obesity in adolescents. The purpose of this plan is to reduce the body mass index in obese adolescents and help them adhere to a weight loss program by utilizing motivational interviewing. The target audience for this presentation is healthcare providers. Obesity in adolescents is defined as having a body mass index percentile greater than 95 when plotted on the CDC growth chart. If a child is obese between the ages of 12 and 18, they have a 60% greater chance of becoming obese as an adult. This also increases the number of comorbidities the child is at risk for. 40% of obese adolescents already have at least 2 or more risk factors for heart disease, and type 2 diabetes now accounts for 20% of the diabetes in children aged 11 to 19. Not only is this a significant problem because of all the comorbidities, but also children who are obese have a decreased quality of life and life expectancy compared to healthy children. Since obesity has been steadily increasing in this population over the last 30 years, it is very important that the family nurse practitioner recognize this problem and do something to address it. By targeting this audience now, hopefully we will be able to reduce the amount of comorbidities this population will experience in the future. 4 randomized control trial articles were reviewed to assess the effects of motivational interviewing on adolescent obesity. These 4 studies found that the addition of motivational interviewing to diet and exercise increased adherence to a healthy lifestyle and decreased adolescent obesity. These studies form the basis for a proposal to guide a group of obese adolescents at a local family practice office in motivational interviewing along with healthy eating and exercise for 6 weeks to help them reduce their body mass index. The goal is to show providers at the clinic how useful motivational interviewing is and get them to utilize it in their everyday practice. The studies were all similar in their design and study. They were all randomized control trials, thus making them a Level 2 research study. They were all conducted in the past 5 years and studied the effects of motivational interviewing on adolescent obesity, producing positive results. They all also had the same exclusion criteria of any underlying diseases causing obesity. They were all conducted in outpatient clinics. But there were also several differences between the studies as well. All studies were looking at slightly different outcomes and had very different sample sizes. Only one study was based on a theory, and 3 of the articles focused directly on motivational interviewing with adolescents, but one of the studies conducted the motivational interviewing just with the parents. So to implement the plan, a flyer will be placed in the lobby of the clinic. Participants will be recruited from either the flyer at the clinic or by direct referral from the physician. The target population is obese adolescents. This population has a strong need for intervention because obesity is a growing problem for them. The clinic is the perfect place to access them because they must come for their school physicals. Participants must be between the ages of 12 and 17 with a BMI of 30 or greater. They must currently be a patient at the clinic and have no medical conditions that would cause the obesity. Once the potential participant is identified, the risk will be reviewed and discussed with the participant and their parent or guardian. If they agree, assent and parental permission will be obtained. Once they are obtained, the participant must meet with the provider to get an official measure of BMI and clearance to participate in the program. Ashley Sachs will then set up an initial meeting with the parent or guardian and patient to discuss the plan for the next 6 weeks at the family care clinic. The program officially begins with everyone having an initial meeting with the nutritionist to establish a healthy eating plan for the next 6 weeks, and they will receive a list of healthy foods to help their parents grocery shop. Each person will have to commit to walking for 30 minutes 3 to 4 times a week for the next 6 weeks. Both groups will follow that plan, and their BMI will be measured at the beginning of the program, at week 3, and then again at week 6. The motivational interviewing sessions will consist of 30 minutes at 3 different times throughout the program. There will be a session at the beginning of the program, at week 3, and then at week 6. The participators' adherence to the program in both groups will be assessed at week 3 and then at the end of the program. Data will then be analyzed and final results will be compiled into 2 charts, one for adherence and one for percentage of weight loss. Once the charts are complete, they will be transferred to a line graph, where the information will be plotted at the 3-week mark and then again at the 6-week mark to show how effective MI is over the course of the entire program. Once all of the results are compiled, it's time to act on them. The results will then be distributed to the primary providers at the clinic and the clinic manager to see if they would be willing to get trained in motivational interviewing and if they would be willing to implement it with this population in their clinic. Adolescent obesity is a huge problem that has been growing at a steady rate for the past 30 years. Motivational interviewing is a very valuable tool that can be utilized in addition to diet and exercise to help adolescents decrease their BMI and increase adherence to a weight loss program. Because of this, it is very important that nurse practitioners become trained in how to use it and implement it in their everyday practice when they have a patient they believe could benefit from it. By utilizing this intervention, adolescent obesity could be reduced, thus eliminating several very serious health problems down the road. This would hopefully create fewer chronic conditions for this population as they age. Thank you.